Changes in the cardiovascular system. You can see the left side as with menopause and aging, there is reduced physical activity and mood instability, sarcopenia. This all can lead to obesity, and obesity can lead to atherosclerosis, which can cause ischemic heart disease or stroke. In menopause, there is estrogen is reduced. This reduced estrogen has various effects. It increases cardiovascular risk factor indirectly. It can cause visceral adiposity, then dyslipidemia. LDL is increased and HDL, the good cholesterol, is reduced. So low density lipoproteins are increased and high density lipoproteins are decreased. There is also increased triglycerides. Insulin resistance is also there, plus there may be increased blood pressure and there may be chronic inflammation. The direct effects on the vasculature are activation of the renin-angiotensin system, increased angiotensin 2, which lead to increased endothelin 1 and decreased nitrous oxide synthesis. And because of this, there is oxidative stress, which lead to vascular cell proliferation and vascular wall inflammation. This leads to arterial stiffness and endothelial dysfunction. The total effect is atherosclerosis, and this increases the chances of ischemic heart disease and also of the stroke. Premenopause menstruations. Around perimenopausal time, there may be gradual decrease of flow and duration during menstruation, or else sudden stoppage of menstruation also can occur, but this is rare. Sometimes menopause is preceded by irregular cycles. The length of the cycle may be variable. It may be shortened or it may be lengthened, or it may or may not be with the heavy flow. Sometimes there is a scanty flow, sometimes heavy flow, sometimes there is normal flow. Before diagnosing menopause or perimenopausal condition, we should always rule out cancer of the endometrium or cancer of any other part of genital tract. Now, what are the symptoms? Common symptoms are hot flashes, or there can be night sweats, or patient can have sleep disturbances. Hot flashes are generally only on the area above waist. Generally it is around neck and face. Patient may feel sudden feeling of heat followed by profuse sweating. There may also be palpitation or weakness, or patient may feel very tired. These changes are because of sweating, and there is dilatation of the skin vessels, and these are because of the thermoregulatory function is disturbed. So this flash always coincides with GnRH pulse secretions and increase in LH level. It may last for a few minutes, but at times it is very unbearable and patient may want to have fan or AC, and sleep will be disturbed because of these night sweats. Next, sleep disturbance is very often. The next symptoms are genitourinary symptoms. They are often called as genitourinary syndrome of menopause. This could be because of atrophic changes of the bladder. Bladder epithelium also becomes thin and it becomes prone to damage or infections. The vaginal pH becomes now alkaline and introitus becomes narrow. Sometimes there may be incontinence of urine, or there may be urgency. Patient sometimes has Dysuria. Because of the narrow vagina, patient may experience dyspareunia. Because of vaginal dryness and atrophy, there may be dyspareunia. Then some other symptoms are psychological symptoms. Patient may be having irritability or patient may be having mood swings. There can be poor memory or she may be always anxious. Sometimes there is depression and there may be headache. What are the skin and hair symptoms? Patient may have crow's feet developing. Skin loses elasticity gradually and there may be wrinkling of the skin. Pubic hair and axillary hair, the secondary sexual character hairs, will become less and she may develop slight baldness. There are some skin disorders which may be associated with menopause, like atrophic vulvogenitis, vulvar lichen sclerosis, diastatic vulvodynia, and hirsutism. There may be androgenetic alopecia. And often there is vulvovaginal candidiasis.